Before your feet even touch the floor in the morning, before the first cup of coffee, before you say a single word to anyone, it starts. That thick, heavy feeling sitting at the back of your throat, and without even thinking about it, you do what you have done every single morning for months now, maybe longer. You clear your throat. Once, twice, 3 times. Maybe you cough a little. Maybe you reach for water on the nightstand, hoping that will move it. And for about 30 seconds, there is a tiny moment of relief. Then it is right back, exactly where it was, like it never left. I want you to think about how many mornings that has been your reality. Not a week, not a month. For many of you watching right now, it has been a year, 2 years. Some of you are going to tell me in the comments it has been longer than that. And at some point along the way, someone, a doctor, a family member, a well-meaning friend, looked at you and said some version of the same 4 words. This is your age, just accept it. And because you trust the people who care for you, some part of you started to believe that, started to build your mornings around it, started to carry throat lozenges in your pocket and excuse yourself from conversations and quietly stop mentioning it because you had been told there was nothing to be done. I am here today to tell you that is wrong. That is not aging. That is a signal. And your body has been sending it to you every single morning, patiently, persistently, waiting for someone to finally explain what it actually means. My name is Dr. Pablo. I am a board-certified geriatrician with 18 years of clinical experience, working specifically with adults over 60, with a deep focus on cardiovascular and systemic health in the aging body. And in those 18 years, I have sat across from hundreds of patients who were told to simply accept this exact symptom: persistent throat mucus, chronic throat clearing, that unshakable sensation of something stuck that no amount of water or coughing fully resolves. And in the vast majority of those cases, when we actually looked carefully, when we took the time to trace the symptom back to its true origin, we found something completely treatable. Something that had been missed, not because it was complicated, but because nobody had taken the time to look in the right place. Today that changes for you. Here is what I need you to understand first, because this one piece of physiology explains everything that follows. Mucus is not the problem. I want you to really absorb that before we go any further. Your body is not malfunctioning when it produces mucus. It is doing exactly what it was designed to do. Every single day, without any conscious effort from you, your body produces mucus continuously. And it does so because mucus is one of the most sophisticated defense systems your body has. It traps airborne particles, bacteria, and irritants before they can penetrate deeper into your lungs. It keeps the lining of your airways moist and protected. It is your immune system's first responder, working silently around the clock. The problem, the real clinical problem, begins only when that normally fluid protective layer becomes thick and sticky and accumulates in the throat rather than being cleared naturally. When it stops moving the way it should and starts building up into that heavy, persistent sensation you wake up with every morning. And here is why this matters so specifically for you, for adults over 60. Because aging changes the equation in ways that most people are never told about. The small, hair-like structures lining your airways, structures called cilia, whose entire job is to sweep mucus upward and out of the system, work more slowly with each passing decade. The muscles involved in swallowing become gradually less efficient. The lymphatic system, which drains excess fluid from your tissues, operates at a reduced capacity compared to your younger years. What this means in practical terms is that an irritant or a trigger that might have caused a barely noticeable mucus response when you were 45 can cause a persistent, genuinely disruptive response at 68 or 72. The mucus is the same. The triggers are often the same. But your body's ability to clear it quietly and quickly is not the same. And nobody explains this to patients. They just say it is your age, as though that closes the conversation, when actually it opens it. Because understanding this is the first step toward doing something about it. Now I want to tell you about a patient of mine. a man named Thomas, 66 years old, a retired high school football coach from Ohio. Big man, proud man, the kind of person who spent 40 years projecting his voice across a field and never thought twice about his health. Thomas came to see me after what he described as 18 months of feeling like he had a wet sock permanently lodged at the back of his throat. His words, not mine. He had been prescribed a nasal steroid spray by his primary care doctor, told it was post-nasal drip, used it faithfully for 4 months and noticed almost no improvement. He had tried every over-the-counter antihistamine on the shelf. He had cut back on dairy because his neighbor told him dairy causes mucus. Nothing worked. When Thomas and I sat down together and I went through his full picture carefully, his sleep habits, his medication list, his meal timing, his morning routine, I found not one cause but a combination of 3 distinct and overlapping factors, none of which had ever been identified or addressed properly. Within 5 weeks of targeting those specific causes with a practical approach, Thomas called my office and told my nurse that he had coached his grandson's Little League practice the entire afternoon, without clearing his throat once. He said it was the first time in a year and a half that he had not been self-conscious about it. Thomas did not need a miracle. He needed the right information, and someone willing to look carefully enough to find it. That is what today is about. I am going to walk you through the real causes of persistent throat mucus in adults over 60. Not the surface-level explanations most people receive. The actual physiological mechanisms driving this symptom that keep getting missed. And I am going to give you a practical, specific plan you can begin implementing today. But I need you to stay with me because the single most important cause, the one I find most consistently hiding behind this symptom, the one responsible for the majority of cases I see in my practice, is coming up shortly. And it is the one that most surprises patients when they finally hear it explained properly. I have seen this one piece of information genuinely change people's lives. So stay right here with me. Let us start with the cause that I consider the most critical and the most chronically overlooked in this patient population. It is called silent reflux. And I want to be precise with you here because there is a very important distinction that most people never hear made clearly. When I say reflux, your mind likely goes immediately to heartburn, that burning sensation in the chest after a heavy meal or a strong cup of coffee. That is classic acid reflux, and many of you have experienced it at some point. But silent reflux is an entirely different presentation, and the difference is not small. It is the difference between a symptom that announces itself loudly and one that operates completely beneath your awareness while doing real, ongoing damage. With silent reflux, stomach acid does not stop at the lower esophagus the way it does in classic heartburn. It travels further, all the way up through the esophagus and into the throat, the larynx, the area around your voice box. And because the throat and vocal cords have virtually none of the protective lining that your stomach and lower esophagus have, even microscopic amounts of acid reaching these tissues cause significant irritation. Your throat was simply never designed to handle acid contact, not even small amounts, not even occasionally. Here is what makes this condition so persistently missed. In many cases, there is no heartburn, no burning in the chest, no obvious digestive discomfort after meals, just that persistent need to clear the throat, particularly in the morning. A subtle roughness in the voice when you first wake up. Sometimes a mild sensation of something caught, something that never quite clears. And that mucus, that thick, stubborn mucus that is always worse after lying down and never fully resolves no matter what you try. What is happening at the tissue level is this. Your throat, sensing the microscopic acid contact, triggers an immediate protective response. It increases mucus production to coat and shield the irritated tissue. This is completely logical biology. Your body is doing exactly the right thing. The problem is that when the acid exposure continues night after night, the mucus production continues to be triggered night after night. And no lozenge, no antihistamine, no amount of honey and lemon addresses what is actually driving the response, because what is driving it is happening while you sleep, and you are not even aware of it. There is also a second mechanism at work here that I find almost no one outside of a specialist's office ever hears explained, and it makes this condition considerably more stubborn than most people realize. Inside your stomach lives a protein-digesting enzyme called pepsin. Its job under normal circumstances is to break down the proteins in your food, and inside the stomach where it belongs, it does this perfectly well. But when reflux occurs, pepsin travels upward along with the acidic vapor and deposits itself onto the lining of your throat. And there it sits, dormant, waiting. What reactivates it? Anything acidic that reaches your throat afterward. Your morning coffee, a glass of orange juice, a carbonated water, a tomato-based sauce at dinner. The moment that acidity touches the pepsin sitting on your throat lining, it reactivates. And with no food proteins nearby to digest, it begins working on the proteins of your own throat tissue. Your body detects this microdamage, responds by producing more mucus, and the cycle continues. This is why the symptom feels so relentless, because the trigger is not just happening at night. It is being reactivated throughout the day by ordinary foods and drinks you would never think to connect to a throat symptom. Now I want to pause here for just a moment because if what I have described so far is resonating with you, if you are sitting there thinking that this sounds exactly like what you have been experiencing, I want you to write something in the comments right now. Tell me your age, and tell me where in the world you are watching from. I read every single comment personally, and I genuinely want to know who is in this community with me today. You are not alone in this, and knowing that someone on the other side of a screen took the time to actually explain this to you, that matters. So drop your age and your location below right now while we keep going. The second cause is one that shares some surface similarities with silent reflux, but has a completely different origin and requires a completely different approach. It is chronic low-grade sinus inflammation, producing what medicine calls post-nasal drip. And I want to be careful here because I am not talking about the dramatic sinus congestion most people picture, the kind with severe pressure headaches and completely blocked breathing that arrives with a bad cold and announces itself unmistakably. I am talking about something far quieter and far more persistent than that. A mild, chronic inflammation of the sinus lining that produces a slow, steady drainage of excess mucus downward into the back of the throat, particularly during the night when you are lying flat and gravity is directing everything toward your airway. Many adults over 60 living with this condition have been buying antihistamine tablets from the pharmacy for months, sometimes years, assuming they are dealing with a seasonal allergy. And the antihistamines may offer a small amount of temporary relief by drying the mucus. But dried, thickened mucus that cannot move efficiently is often more uncomfortable than the original drainage was. You are not solving the problem. You are changing its texture and making it harder to clear. I had a patient named Carol, 69 years old, a grandmother of 4 who had spent 30 years as a dental hygienist before retiring. Carol came to me with what she described as a throat that felt like it was lined with wet cotton every single morning. She had been taking the same over-the-counter antihistamine tablet every night for 11 months. It took the edge off, she told me, but by mid-morning that heavy feeling was back regardless. When I asked Carol about her sleep position, she told me she slept flat on her back with one standard pillow. When I asked about her home environment, she mentioned that she and her husband had recently replaced their old forced air heating system, and the new one ran constantly through the winter months, producing very dry indoor air. When I asked whether she had ever tried nasal rinsing, she looked at me as though I had suggested something slightly unusual. She had not. Within 3 weeks of beginning a consistent daily nasal rinse with a warm saline solution and adding a small humidifier to her bedroom, Carol told me the wet cotton feeling in her throat had reduced by what she estimated was about 70%. Not gone entirely because we still had other factors to address, but dramatically, noticeably better from 2 changes that cost her almost nothing. The approach for this cause is nasal rinsing, and I want to be specific with you about how to do it properly, because the details matter. Use water that has been boiled and allowed to cool to a comfortably warm temperature. Never use straight tap water directly in the nasal passages, as tap water in many areas contains trace microorganisms that are harmless when swallowed, but should not be introduced into the sinuses directly. Dissolve a small amount of plain non-iodized salt into the cooled boiled water and add a very small pinch of baking soda alongside it. The baking soda helps neutralize acidity in the nasal passages and supports the thinning of mucus more effectively than salt alone. Use a simple nasal rinse bottle available at any pharmacy and rinse each nostril gently once in the morning and once before bed. The consistency matters far more than the complexity. Done regularly, this one habit has produced genuinely meaningful improvement in patients who had been suffering for months without finding relief from anything else they tried. The third cause is one that I raise with particular care because it involves something many of my patients are already taking under their doctor's supervision, and I want to be absolutely unambiguous about this before I say another word. Do not stop or change any prescribed medication based on anything I say in this video, or anything you read or hear anywhere outside of a direct conversation with your prescribing physician. What I am about to share is information. It is medically recognized, it is documented, and it is worth knowing. But the appropriate response to this information is a conversation with your doctor, not an independent decision to alter your treatment. With that said clearly, here is what you need to know. Certain medications that are commonly prescribed to adults over 60 can contribute directly and significantly to persistent throat mucus. There is a class of blood pressure medications, among the most widely prescribed drugs in this country for adults in this age group, that in some people produces a well-documented side effect involving persistent throat irritation, a dry, tickling sensation, and increased mucus production as the body's reflex response to that irritation. The mechanism involves a naturally occurring compound in the body that these medications allow to accumulate at higher levels than normal, and in susceptible individuals that accumulation triggers an ongoing irritation response in the throat that feels remarkably similar to postnasal drip or silent reflux. Patients take antihistamines for it, they try throat sprays, they cut out dairy. They do everything except connect it to the small white tablet they take every morning for their blood pressure, because nobody ever told them the connection existed. If you take blood pressure medication, and your throat symptoms began or became meaningfully worse within the first several months of starting that medication, please raise this specifically with your doctor at your next appointment. There are alternative medications in different categories that manage blood pressure just as effectively without this particular side effect. And for patients in whom this is the primary driver of their throat symptoms, switching categories under medical supervision has sometimes resolved the problem almost entirely within a matter of weeks. There is also a second medication-related mechanism worth understanding. Certain anti-inflammatory medications taken regularly for joint pain, arthritis, or other chronic discomfort can gradually weaken the muscular valve separating the stomach from the esophagus, making it easier for stomach contents to travel upward. They can also reduce the stomach's own protective lining over time, increasing acid production as a compensatory response. Both effects can intensify silent reflux significantly in people who are already prone to it, without anyone ever connecting the joint pain medication to the throat symptom. If you are taking anti-inflammatory medication regularly and also dealing with persistent throat mucus, this connection is worth a direct and specific conversation with your doctor. I had a patient named Frank, 73 years old, a former building contractor who had developed moderate arthritis in both knees after decades of physical work. Frank had been taking an over-the-counter anti-inflammatory tablet almost daily for 2 years to manage his knee discomfort, and had developed persistent throat clearing over roughly the same period. Like many patients, he had never drawn any connection between the two. When his doctor, with whom I consulted on the case, carefully transitioned Frank to a different approach for his knee pain, and we addressed the reflux that the medication had been quietly worsening, Frank's throat symptoms improved substantially over about 8 weeks. He told me at his follow-up that he had not realized how much mental energy he had been spending on his throat every single day until it was no longer there. The fourth cause is one that I consider critically important and that is consistently underestimated, and it operates through two mechanisms that work together and amplify each other in ways that most people never recognize. The first mechanism is environmental irritation. The second is inadequate hydration. And in adults over 60, these two factors interact in a way that produces a chronic, self-reinforcing mucus problem that no single remedy addresses because both sides of the equation need attention simultaneously. Your airway lining is in constant contact with whatever is in the air around you. Dry indoor air from heating and air conditioning systems, wood smoke from fireplaces, traffic pollution, strong chemical fumes from cleaning products, even heavily fragranced candles and air fresheners. All of these create ongoing low-grade irritation of the airway lining that triggers mucus production as a continuous protective response. This is not an allergy. It does not require a specific sensitivity. It is simply the body responding logically to a constant low-level chemical challenge by building a protective coating. And in an older airway where the cilia are already working more slowly and mucus clears less efficiently, that protective coating accumulates faster than it is cleared and produces exactly the persistent thick sensation you experience every day. Now layer inadequate hydration on top of that, and the problem compounds significantly. When your body is not sufficiently hydrated, the mucus it produces becomes thicker and stickier. The physical difference is dramatic. Well-hydrated mucus is thin and fluid and moves easily through the system, being cleared naturally without your awareness. Dehydrated mucus is dense and adhesive and accumulates in the throat rather than flowing through it. And here is the piece that I find most important to convey to my patients in this age group specifically. The thirst mechanism becomes less sensitive and less reliable as we age. Meaningfully less reliable. Research published in the journals of gerontology has documented this clearly. You can be in a state of clinically relevant dehydration and feel only mildly or even not at all thirsty. If you are waiting for thirst to tell you when to drink, you are almost certainly operating in a state of mild, chronic dehydration without knowing it, and your throat is one of the places where that dehydration is showing up most visibly. A practical hydration target for most adults is approximately 30 milliliters of fluid per kilogram of body weight per day from all sources, including water, herbal teas, broths, and water-rich fruits and vegetables. But rather than calculating that every day, a simpler and more sustainable habit is this. Begin every single morning before your coffee, before breakfast, before your medications, with one large glass of warm water. Not cold water. Warm. Warm water rehydrates the throat tissue directly and immediately begins to thin and loosen the mucus that is accumulated and thickened overnight during the hours when you were not drinking anything. This one habit, which costs nothing and takes 30 seconds, is something I recommend to virtually every patient dealing with persistent morning throat symptoms. Many of them come back and tell me it produced a noticeable difference within the first few days. Not a complete solution on its own, but a meaningful, immediate, and consistent improvement. I also want to address one more cause that the original conversation around throat mucus almost never includes, and that I have become increasingly convinced plays a significant and underappreciated role in this patient population, and that is the physiological impact of chronic psychological stress on mucus production and airway inflammation. I raise this not to suggest that your throat symptoms are imaginary or psychological in origin, because they are absolutely not. I raise it because the connection is real, it is measurable, and it is worth understanding. Research from institutions including Harvard Medical School and published in journals including Psychoneuroendocrinology has documented clearly that chronic stress elevates circulating levels of cortisol and inflammatory cytokines in the body. In the airway specifically, this chronic low-grade inflammatory state increases mucus secretion and reduces the efficiency of mucociliary clearance, which is the system responsible for moving mucus out of the airways. In plain terms, a body under sustained stress produces more mucus and clears it more slowly. For an older adult whose clearance mechanisms are already operating at a reduced capacity, the addition of chronic stress can tip a manageable situation into a persistent and genuinely disruptive one. I want to be specific rather than vague about what I mean by stress management, because I think the phrase has become so overused that it no longer carries practical weight. I am talking about a daily, consistent, physiologically grounded practice. Diaphragmatic breathing, the kind where you breathe deeply into the belly rather than shallowly into the chest, practiced for even 10 minutes daily, has been shown in research published in Frontiers in Human Neuroscience to measurably reduce cortisol levels and inflammatory markers. A daily walk of 20 to 30 minutes outdoors does the same. Time and genuine social connection, not obligation-based interaction but real, warm, chosen connection with people who matter to you, has one of the most powerful anti-inflammatory profiles of any intervention studied in older adults. These are not soft suggestions. They are physiological interventions with documented measurable effects on the very mechanisms driving your throat symptoms. Think of them as part of your treatment plan, because that is precisely what they are. Now let me give you something concrete. A specific practical evening routine you can begin tonight, built around everything we have covered, designed to address the mechanisms that are most active while you sleep. At least 3 hours before you plan to lie down, finish your last meal or snack. This gives your stomach adequate time to empty under the advantage of gravity before you remove that advantage by lying flat. Your evening meal should be the lightest of the day. Lean protein, gently cooked vegetables, moderate portions. Save heavier, more elaborate meals for lunchtime when your digestive system has the full benefit of the day ahead. In the hour before bed, avoid coffee, alcohol, carbonated beverages, chocolate, peppermint, citrus, tomato-based foods, and anything heavily fried or fatty. I want to specifically mention peppermint here, because many people reach for peppermint tea in the evening, believing it is soothing for the throat. Peppermint can actually relax the muscular valve between the stomach and esophagus, potentially worsening the exact reflux mechanism we have been discussing. Chamomile tea without added mint is a far better choice for the evening. Fresh ginger tea made from actual ginger root, not a commercial sugary preparation, supports digestion and has genuine anti-inflammatory properties. About 30 minutes before bed, do your nasal rinse. Warm, boiled and cooled water, plain non-iodized salt, a small pinch of baking soda, both nostrils, gently. This clears the inflammatory load that has accumulated in the sinuses throughout the day and reduces the overnight drainage that contributes so significantly to that morning throat sensation.